Hello, everyone. My name is Gurjat Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm pleased to welcome you all to the third session of the day titled Nutrition for Lymphoma Patients. This is a topic that we get a lot of questions about, so I'm pleased to be featuring this session in this year's conference. We appreciate that so many of you can join us online today. And before I introduce today's speaker, as always, just a reminder that this Zoom software does not allow you to access video features or turn on your microphone. And at the end of the presentation, we'll try and take as many questions as we can. So to introduce our speaker, joining us today is Jenny I, who is a registered dietitian with a special interest in oncology and clinical nutrition. She currently specializes in supporting patients with the leukemia, lymphoma, myeloma, and cellular therapy programs, providing evidence-based nutrition care throughout treatment and recovery. With a strong focus on improving quality of life and treatment outcomes, Jenny works closely with multidisciplinary teams to develop personalized nutrition strategies. So thank you so much for joining us today, Jenny, and you can get started as soon as you're ready.
Wonderful. Thank you so much for having me today. And thank you all for joining me today on this Friday evening. My name is Jenny, and I'm currently a registered dietitian at the Princess Margaret Cancer Center. And I am excited to speak to all of you about nutrition for lymphoma and CLL patients. So let's get started. A brief outline. So I do want to chat a little bit about the role of a dietitian, the importance of nutrition, nutrients and calories, what eating well during treatment might look like, what eating well after treatment might look like, the mental and emotional impacts of food, and finally, a brief conclusion and summary. I also have a couple of learning objectives. So number one, understanding the role of nutrition during cancer treatments. Second, understand the benefits of being well-nourished throughout treatments. Number three, identify common nutrition-related side effects of cancer treatments. And finally, perhaps learn practical strategies, dietary strategies to manage treatment-related side effects. So jumping right into it, I did want to start off with introducing myself and the profession. So who are we as registered dietitians? Registered dietitians are regulated health professionals that provide evidence-based nutrition recommendations. We are regulated by a college. So in Ontario, here it's the College of Dietitians of Ontario. And so how can a dietitian help throughout treatments? We provide one-on-one care and individualized strategies, recognizing that cancer care is not a one-size-fits-all. It's going to be different for everyone, treatments, side effects, how we approach things. So it's great to have a dietitian on your team, have a good whole picture of what is going on. Dietitians are also here to reduce stress and confusion around food, and again, focusing on evidence-based research and recommendations. Also understanding that the internet is quite vast and there's a lot of information there. So it's hard to kind of compile it together or know what's right or what's wrong. And finally, we are members of the healthcare team. So again, working closely with nurse practitioners, doctors, other allied health members. So we do have a good grasp of what your overall treatment plan would be, and we'd be able to provide you recommendations based off of that, right? Okay, so in the importance of nutrition. Why is nutrition important? Nutrition is important because it helps maintain our strength before, during, and also after our treatments. Nutrition is important because it helps us prevent unintentional, unwanted weight and or muscle loss. Nutrition also helps support our immune system with all of the important nutrients that our body requires. It also helps promote recovery and healing while on treatments, and also perhaps improve tolerance to treatment by maintaining our strength and our energy. It can be very helpful, especially if the body is going through multiple cycles of chemotherapy or treatments. So breaking it down a little bit, nutrients and calories. So we might have heard about calories, and what are calories, right? So calories are the energy that fuel our essential body functions and comes in in the form of carbohydrates, fats, and protein. It is our body's fuel. So basically, think of a car. The car cannot run without gas, and the body cannot run without calories or energy. I do get a lot of questions about how do I know if I'm eating enough calories? And you'll notice here in a lot of my slides, I'm not focusing on the grams of protein or how many calories you need in a day, recognizing that again, it is very individualized and it will depend on everyone's case-to-case basis. But a good way to take a look and see whether or not you're eating enough calories would be to monitor your weight. If you're noticing some weight loss, that could be a sign that your energy intake is not meeting your energy output, meaning that you need a lot of energy at that time and you're perhaps not fueling the body with enough. Or alternatively, if your weight is stable, for example, your energy intake is meeting your energy output, so it's balanced. Typically, for oncology patients and lymphoma patients, your calorie requirements are much higher than what a typical individual's would be. And that's because your body is under a lot of stress. It's going through treatment. It's working really hard to recover, even if it doesn't feel like you're as active as you usually are. So breaking down the nutrients, macronutrients, these are the nutrients that our body needs in large amounts. So our protein, our fats, and our carbohydrates. These are our sources of energy for our body. Then we've got our micronutrients, which would include vitamins and minerals, and we need these in smaller amounts. And I did want to highlight the question, what about supplements? Just because that question does come up quite often. I find that the best way, if possible, to get your vitamins and minerals is through whole food. And typically, if we are eating adequately, we are likely meeting our vitamin and mineral requirements, maybe with the exception of vitamin D, just because we don't get a lot of sun here. But my suggestion is to speak with your medical team, your doctor, your pharmacist, or your dietitian before wanting to start any type of vitamin or mineral supplement. I say that because sometimes these doses can be quite high or some of these ingredients may have it's contraindicated with some of the treatment medications that you might be taking. So it's better safe than sorry. And my suggestion is to reach out to the team, but also confidently knowing that if you are eating okay, then you're likely getting the vitamins and minerals your body requires. So I'm going to go into a little bit more depth about our macronutrients. So speaking about protein first, and protein is pretty important, but why is it important? It's important because it helps maintain our muscle mass. It's the building blocks for our muscles. It helps us maintain a healthy weight. It also helps with our immune system. Proteins break down to essential amino acids that our body requires. Again, how much protein do I need? No numbers here. Everyone's a little bit different, but again, overall, oncology patients do require higher protein. I like to focus more so on educating on what foods contain protein so that you can make good choices when you're looking to include protein into your diet. So once you sort of understand what foods contain protein, then you can go ahead and choose proteins at every meal and snack. That would be my recommendation, is to include one at every meal and snack that you're having. So protein in our diets, you can find protein in two different places. So our animal protein, which includes our chicken, beef, pork, and fish, and these sources typically will contain the most amount of protein. You can also find protein in dairy products like milk, Greek or Icelandic yogurt, cheeses like ricotta, hard cheeses like cheddar, or even cottage cheese. And of course, eggs and egg whites contain protein too. You can also find protein in plants, which is great, especially if you are, again, vegetarian or you're looking to include a more variety of protein into your diet. So legumes, lentils, chickpeas, beans like edamame, kidney beans, soy products, and tofu also contain protein. So like soy milk, for example. And then also nuts and seeds. So that could be your chia seeds, your hemp hearts. That could be almonds, walnuts, peanuts, nut butters like almond or peanut butter too. So the next macronutrient I wanted to speak a little bit about are our carbohydrates. So carbohydrates are the body's main source of energy. It provides fuel to our brain, our organs, and our muscles. Carbohydrates break down into glucose, which is a type of sugar that our body uses, and it's actually our brain and our body's preferred energy source. So breaking down carbohydrates further, there are simple carbohydrates, so broken down quickly by the body to provide a fast source of energy. And then there's also our complex carbohydrates. So these ones are a little bit longer, and it takes a little bit longer for our body to break down. So providing a gradual release of energy and helping you feel a bit fuller for longer too. Complex carbohydrates also contain really good fiber, which is important for our body, as well as vitamins and minerals our bodies use as micronutrients. So where can you find carbohydrates in our diet? Again, simple carbohydrates typically can occur naturally, refined, or as an added sugar. So naturally, you can find simple carbohydrates in fruits, so like fructose, milk and dairy products like lactose. Refined or added sugars are found in, for example, candy, soda, baked goods, table syrup, and honey. Our complex carbohydrates you can find in our whole grains, our legumes, our starchy vegetables as well. Again, complex carbohydrates contain dietary fiber, and fiber is essentially a type of carbohydrate that our body doesn't digest. So, soluble fibers are typically fibers that gel up. So, if you think of like oatmeal or chia seeds, if you were to cook it, it kind of has that like outer gel type of consistency. And soluble fiber is really great for, again, our bowel movements. It's great for also our blood sugar and our cholesterol levels. Insoluble fibers are more so those like the roughage, right? So it can help again with bowel regularity. So maybe as an example, like leafy greens, or even like if fruit with the skin on, as another example of insoluble fiber. So we're talking a lot about carbohydrates and sugar, and I did want to address a question that does come up quite frequently. I do hear a lot about sugar and cancer. I get questions about, hey, does sugar feed cancer? Does sugar cause cancer? And I wanted to preface this by saying cancer growth and metabolism is very complex. So there's a lot of different components to this. Sugar is a type of carbohydrate, and like I previously mentioned, sugar also tends to be our body's main source of energy or preferred source of energy, right? And it's not considered a carcinogen, which is a cancer causing agent. So, something about sugar, because it is our body's main source of energy, if we're not feeding our body with adequate amount of sugar, it can actually convert protein and fats into sugar for our body to use. And oftentimes that's where we see weight loss. If you're intentionally starving the body of its main energy source, it's going to, for example, say, okay, we're not getting enough sugar from the food, so we don't need Bob doesn't need his muscles. So let's break down the muscles, get the sugar we need to fuel the body, and then get going with our day, right? But as a result, Bob is losing weight because they're also losing muscle mass. So it is not recommended to fully eliminate sugar because starving our cancer cells also means in turn you're starving our healthy cells. And that's not what we would want. And again, we're looking to prevent unintentional weight loss and muscle loss. But something to keep in mind, and everyone can sort of use this recommendation, myself included, by choosing more complex carbohydrates more often. So if you're eating well and you're not losing weight, you're doing good, you're at post treatment, complex carbohydrates will give you those vitamin, minerals, and fiber, right? And maybe limiting added sugars when possible, but everything in moderation too. And I always highlight that if you're going out for a birthday celebration and you want a slice of cake, or if it's a hot summer day where it's really you would really love an ice cream, then go for it, right? I always joke with some of my patients that if you're drinking 4 or 5 liters of full sugar Coca-Cola, then we might have to talk. But if you're enjoying yourself once in a while, it's not likely going to do much harm. And I also wanted to highlight, I say this when you're eating well, because if you are an individual that's going through treatment and really struggling to eat, and you're telling me that I am not eating 3 meals a day, I can maybe only stomach fluids, then I would say drink that juice, get some mango nectar, drink that ginger ale, drink that Coca-Cola, because that that simple sugar is providing your body with the essential energy that it needs to keep going, right? And then maybe once you're starting to feel a little bit better, that's where you have that flexibility to maybe choose more complex carbohydrates, right? And limiting added sugar as a result. So good. I also wanted to chat a little bit about fat. Fat is also very important. It actually is the most calorie dense macronutrient, and it can be very helpful, especially in optimizing the calories when you're really struggling to get in food in terms of like larger volumes. Fats are really important for our brain. It's important for the absorption of certain vitamins, and it also helps insulate our body and cushions our organs. So it is very essential. Some healthy fat choices, or some fat choices that I've listed here: avocados, nuts and seeds, fatty fish like salmon, olives, olive oil, as well as coconuts. It's not listed in this slide, but fats are also broken down into saturated and unsaturated fats. And typically, we want to lean towards the unsaturated fats because they're a little bit healthier, better for our hearts compared to like a saturated fat. So now that we've spoken about the macronutrients, I do want to highlight fluids. Fluids are very important because they help keep us hydrated. We definitely want to try our best to prevent dehydration at any time, before, during, or after treatment. And that's when your body doesn't have enough water. So when that happens, you might feel more dizzy, more fatigued. You might also be struggling with your blood pressure, for example, as another example. So trying to stay hydrated is very important because it's also good for moving our nutrients throughout the body and the waste throughout the body and protecting our important kidneys. Everyone's fluid intake is going to be quite individualized again, but it's good practice to aim for 6 to 8 cups of fluid per day. So 1.5 to about 2 liters. Something to note too, if you're an individual that's struggling with diarrhea or vomiting, you might need a little bit more fluids because if you think about it, you're losing a lot of fluids through those symptoms. So you almost have to top up as a result of that too. I do get lots of comments about, hey, Jenny, like drinking 2 liters or drinking that much fluid really fills me up. And that really impacts my ability to eat too. So one of my suggestions is to maybe drink your fluids in between your meals and throughout the day. So if you have one of those big water bottles with a straw, carry it with you wherever you are and take sips when you can. Drinking fluids in between your meals might be helpful so that you leave room for food as well at your meal times. So going into what maybe eating well during treatment might look like, okay? So again, very individualized. And I wanted to highlight that depending on your treatment, depending on your symptoms, you might experience symptoms that might make eating a little bit more difficult, resulting in weight loss, or you might be on a treatment where, for example, you're on steroids or you're eating okay, your weight is stable. So I do want to focus more so on, again, maintaining the weight, preventing unintentional weight loss, and improving your energy levels. And you can do this by following a high protein, high calorie diet. So we learned a little bit about calories, we learned a little bit about protein. So following a high protein, high calorie diet while in treatment can be very helpful, again, preventing unintentional weight loss and improving your energy levels. Number 2, stay hydrated. We just spoke about this. We really want to try to prevent dehydration when possible. We will also want to do our best to manage and optimize side effects of treatment. Again, different strategies for different symptoms. And at times, you might also have to rely on medication that your medical team, your doctors prescribe for you to try to optimize some symptoms, like, for example, anti-nausea medications or anti-diarrhea medications, so that it makes it a little bit easier for you to be able to tolerate food. So here are some examples of nutrition really impacts symptoms. So decreased appetite, fatigue, taste changes, sore mouth, nausea, vomiting, diarrhea, constipation, and abdominal pain. I'll speak a little bit more about the tips and tricks in the next slide as well, but I'm not going to go through all of the individual symptoms. So tips and tricks to eating well while on treatment. These are some good ones that I do like to share. So small, frequent meals throughout the day. Instead of eating breakfast, lunch, and dinner, you might have to throw out the idea of eating breakfast, lunch, and dinner because at that time, if you're experiencing decreased appetite, nausea, or vomiting, or taste aversions, for example, the last thing you're going to do is sit down and eat a large plate of food. So splitting that into 5 to 6 mini meals or finding a way to eat every 2 to 3 hours, a little bit at a time, can be helpful for you to sort of meet the volume that you need by the end of the day. Okay. Um, Staying hydrated with nourishing liquids. So we talk a lot about fluids, but if you're not able to tolerate solids for any reason, let's say because of sores in the mouth or pain in the throat, you're not going to be able to tolerate a lot of solids. So we really need to optimize the calories and the protein in the fluids that you can drink. So some examples could be switching from a 1% milk to a 3% milk, more fats, more calories, same amount of volume. Maybe this is a good time to have some ice cream or choose cream or blended soups like cream of broccoli, cream of mushroom, or even relying on milkshakes or smoothies because typically they're made with higher fat ingredients, right? High fat milk, Greek yogurt. So I often will say it's easier to drink your calories than eat your calories when you're experiencing some of these symptoms. I also put a bullet point there for nutrition supplements. And what I mean by nutrition supplements, it's the Ensure, the Boost, and oftentimes I do recommend speaking with your dietitian or your medical team to just ensure that you are choosing the right supplement for you, recognizing that there's a lot on the market. It's very confusing, but we're also here to help guide that as well. Okay. Eat your favorite food at any time of the day. If you like pancakes at breakfast, eat pancakes at dinner, right? As long as you don't get tired of it. But yeah, if you know that a certain food works for you and you know that it's a breakfast food, but it works well, then make that adjustment. Have the foods that you know you tolerate well or your favorite foods at any time during the day. Also, eat your largest meal when your appetite is best, recognizing that every day is going to be a little bit different. Some days are better than others. But if you know that you feel the best at breakfast, right in the morning, find ways to pack in the calories and protein then. And then do your breakfast. And then, as an alternative, if you're not going to do lunch and dinner, then I would rather you snack every 2 to 3 hours afterwards because the worst thing you could do for yourself really at that time is not eat anything. So even if it's little bits, cheese and crackers, a small yogurt, it is still better than nothing. And then a little tip I like to give is plan ahead. Chemotherapy days, hospital days are long, and sometimes you might not have access to food, a food court, for example. So prepackaged high protein, high calorie snack foods that take little to no preparation are great to bring along with you. So for example, individual hummus cups or guacamole cups, trail mix, granola, maybe one of those nutritional supplements, again, Sure Boost. It might also be a good idea to pack a little lunch bag for long treatment days too, so that you know that you have foods that you tolerate well and that your body will accept at that time. So big chart. I'll go through a couple of them. So food choices and how to optimize calories and protein. So fresh fruits and vegetables get a really good reputation because they're sweet, they're juicy, they're cold, but unfortunately quite low in calories and protein. So some suggestions I like to give is, for example, dip your carrot sticks, celery sticks, maybe in hummus, tzatziki, guacamole, baba ganoush, higher in protein, higher in fats. Again, blending into smoothies, choosing blended soups, or even dipping your fresh fruits in Greek Icelandic yogurt or melted peanut butter. A good snack that I like to share is apple slices with melted peanut butter and chocolate. It's great because you're adding a lot of good fats, as well as calories and carbohydrates to otherwise a very low calorie or protein apple. Eggs, again, maybe adding a splash of cream into your eggs, cooking with extra butter, making egg salad sandwiches or egg salad with mayonnaise. You can have it as sandwiches, toppings, good for, again, crackers or pita. Speaking a little bit about dairy products, choosing those higher fat dairy products if you're struggling. 3% milk, chocolate milk are great. Soy milk is also a wonderful dairy or lactose-free alternative because it contains some protein. Use shredded cheese, hide that in everything. And again, choosing high fat Greek or Icelandic yogurt to optimize the calories as well as the protein. A little bit about meat and alternatives too. I find that a lot of my patients do struggle if they're having a poor appetite or some of these symptoms. Last thing that they're going to do is sit down and eat a big piece of steak. So it's good to also hide ground meats into pasta sauces or casseroles just to boost up the calorie content and the fat contents. Again, making tuna or salmon salad that you can use as dip, sandwiches, or on your salads as well. So just some examples, and you can always kind of look back at this too. So now that we've talked about during treatments, what about after treatments? So again, very individualized because it really depends on what your goals are. If your goal is to work on rebuilding that muscle mass that you potentially had lost or regaining some of the weight that you've lost, then my suggestion is often to continue to follow a high protein, high calorie until you've seen some weight stabilization or weight gain. If your goal is to just maintain, or let's say you're after treatment, you didn't lose any weight, you're feeling good, you're just looking to eat well after treatment, I typically will reference the Canada's Food Guide, and you can see this on the right. The Canada's Food Guide Healthy Plate Model. So it's a balanced diet with a focus of lean protein, complex carbohydrates, healthy fats, fruits and vegetables. You can see half the plate is fruits and veggies, a quarter of it is protein, and there's a lot of good variety in there: fish, tofu, yogurts, a quarter plate of their whole grains. And this again would be a good time to maybe limit or decrease your intake of added sugar and choose more of those complex carbohydrates that will give you good fiber and nutrients. And then a little bit, the last bullet is physical activity as tolerated, right? If you're feeling good, it might be good to go for walks, try to rebuild some of your strength too. Okay, so a little bit about the mental and emotional impacts of food, and I wanted to take some time to speak about this because I find that it's often not spoken about. But as a oncology patient, as a cancer patient, you have a lot going on. You have transportation, you have how many appointments to keep track of, you meet probably 50 people, so it's hard to keep track of everything. And on top of that, you need to try your best to eat and stay nourished. So be kind to yourself. You've got lots going on, right? So keeping that in mind, it's good to manage expectations. Your normal is likely not going to be your normal right at that time. So shifting your mindset when it comes to food and mealtime. So again, if your normal is breakfast, lunch, and dinner, and it's kind of hard to transition to small frequent meals, maybe it would be doing breakfast and then again snacking throughout the day, or snacking a little bit in the morning, or splitting breakfast and lunch into two as a gradual transition. Adapting and making changes in how you view and approach food, depending on your feel, is also how you feel is also important. So maybe we wake up one morning and you're like, "Oh, not feeling great. Don't think I can do what I normally would do. What can I choose instead that will still provide me with the energy my body needs and maybe a little bit of protein too, right?" If you wake up after treatment day and you're like nauseous or you're not feeling well, again, easier to drink your calories than eat your calories, and just recognizing that that is a day that you're having and you might just have to make some shifts here and there. A little bit for the caregivers too, allowing and providing space when needed and setting some boundaries could be helpful as well. Food is the universal language of love, I find. So it's tough to see your loved ones go if they're not eating well, right, struggling, they're losing weight. You're probably quite concerned yourself too. But it's good again to ask, hey, is this a good day? Is this a bad day? What can I do? Maybe pulling from the toolbox of the education that you received, and seeing what is tolerated. Oftentimes I kind of reference, it's like going to grandma's house. You go to grandma's house, you're there, and she's feeding you X, Y, and Z and asking you, are you hungry? Do you want this? Do you want this? And sometimes that constant conversation can be a bit tiring, especially if you already have a low appetite and you're not feeling well, right? So allowing that space, but also still, again, recognizing that it is important to do your best to maintain your nutrition, but within your means and within your symptoms too. Okay. So, in summary, just a quick summary, choose a high protein, high calorie diet if you're experiencing weight loss during treatment. Again, highlighting that if you are on treatments, you are likely going to need more protein and calories than another individual. Again, that is because your body is working really hard for recovery. It's probably under a lot of stress as well. So, making sure that you're prioritizing these two things. Adjust your food choices as needed. Again, recognizing good days versus bad days, what symptoms you might be experiencing, I've seen symptoms differ from each cycle too, and everyone's very different. But as long as you have that toolbox where you know, hey, that's a protein source, that's a calorie source, and you know what you can pull out of that, that can be very helpful. Third, focus on a balanced plate after treatment, or if you're not experiencing nutrition-related concerns or weight loss during treatment. It is still very important to have all different food groups, macronutrients, fat, carbohydrates, and protein, as well as your micronutrients as well. Okay, so good, healthy, balanced plate if you're done treatment, or again, you didn't have any weight loss or nutrition-related concerns during treatment. Fourth, stay hydrated with fluids if you can. Fifth, be kind to yourself. And sixth, seek help from a dietitian. If you're struggling with treatment related side effects or weight loss, we're here to help you and help guide you throughout treatment. If you need a little bit of, again, education or help to maintain your weight, I always suggest trying to get a referral to a dietitian if you can. I also wanted to include some helpful resources. I've only listed 3 here, but the Canadian Cancer Society has a wonderful resource called Eating Well When You Have Cancer. There are paper copies available depending on your hospital and if there's a patient library, but there is also a PDF version online, so there's the link there. This is a wonderful resource because it has everything you need in it in the sense it goes over some tips and tricks on symptom management. It chats a little bit about sugar and cancer, what eating well looks like after treatment as well. So it's a nice tell-all book. It's what I like to give just as a nice resource to have perhaps on the kitchen table. Second is the Elixir Kitchen. This is a part of the Cancer Rehab and Survivorship program here. And it's a wonderful resource because it provides a lot of recipes, cooking demos, as well as recipes depending on the symptom that you're experiencing. And finally, the American Institute of Cancer Research is also a wonderful resource. I really like there's a really great infographic, the AICR recommendations for cancer prevention. I didn't include it in this presentation, but it essentially echoes some of the discussion topics that I had today. So also a wonderful resource to have. And that is it. Thank you so much for having me today. And I will open it up for questions.
Thank you, Jenny, for that very informative presentation. And as a reminder to the audience that at this time you can submit your questions in the chat box, which is in the middle of the black toolbar at the bottom of your screen. And we have had several questions come in, so I'll start from the start. So are there diets that are especially helpful for cancer patients, like macrobiotic or Mediterranean diets? What are your thoughts on that?
Very good question. Again, individual, depends on where you are in terms of your treatment. While on treatment, again, I think it's important to focus on your calories and protein, especially if you are noticing some weight loss. But I have referenced the Mediterranean diet, and I am quite a big fan of it. I think it's great in the sense that it includes those complex carbohydrates, plant-based proteins. It also doesn't exclude animal proteins as well, but you're choosing leaner proteins, right? Like chicken or fish, but not excluding red meat. You're still okay to have it 2 to 3 times a week, and you're choosing healthy fats as well. So I think that the Mediterranean diet would be a good one to look at, and it's pretty in line in terms of my recommendations too.
Perfect. And are supplements like Ensure recommended if other food intake is not as substantial as it should be?
Yes, so another good question. I will always say my approach is food first. So if you can do food, fantastic. But in a situation where, again, maybe 1 meal a day, you're having some of these symptoms where it comes to like mucositis with sores, or you're not tolerating regular food well, I don't find Ensure a meal as a meal replacement, but more so something to help optimize your intake to include alongside food. So the answer, I guess, is yes. Like, again, speak with your dietitian about what's important, or which product would be better for you. But Ensure can certainly be included in your diet if you find that you're struggling with regular food, just to get an additional boost of calories and protein.
The next question is a very interesting one. So, as a
Mhm.
caregiver, is it a good practice to follow the eating patterns of the cancer patient so that you can enjoy meals together? And in this case, the caregiver is healthy and can follow the dietitian's recommendations.
That's actually a really good question too. I haven't had that come up before, but I think um, of course, if the individual is doing well, eating whole foods with good food choices, I don't see why not. Maybe if they're not doing so well with their food intake, then I wouldn't suggest having, for example, a diet only of fluids if that's all that they can tolerate. But I think that would be great. It's a good way to be inclusive, right? And to share experiences, enjoy food together. So I don't see why not.
Perfect. And next we have here, what are some foods to avoid after treatment that are known carcinogens?
Another good question too. So some examples of known carcinogens would be if you're having like barbecue, for example, and you're noticing like those charred bits, it's typically recommended that you maybe like cut those off so you're not having them as much. I think those are considered to be a carcinogen. Another good food, I just missed it. I might have to get back to you about that. I know that the one biggest one to consider is just like being very careful with like charred foods. Those are not good to have.
And there's a question about tea. So generally speaking, is herbal tea safe with chemo or are they known to be unsafe?
So with herbal teas, typically, so I do get this question quite a bit. It depends on the herbal tea. I always say review it with your dietitian or pharmacist and doctor just to make sure that there are no contraindications. Green tea and Earl Grey tea do come up often, and sometimes I do get questions about that. And typically in moderation, it would be okay. So, for example, if you have been a chronic green tea drinker for years and years before diagnosis or treatment, and every day you would have a cup, then that would be okay because you're not having it in excess. Other herbal teas, especially if it's an interesting blend of florals or other ingredients, then I would be a bit more cautious about them because there are risks and that could interact with treatments. But again, like green tea, Earl Grey tea in moderation and not exceeding or all of a sudden wanting to drink 2, 3 cups every single day. If you keep to your norm, then that should be okay.
Okay. And you talked a little bit about this as well, but do you have any recommendations for before starting treatment on how you could prepare in nutritionally speaking? Yeah.
Yeah, so before treatment, again, kind of depends on where you are in terms of your treatment cycle. If you are, let's say, if you're going in for an auto stem cell transplant and you know that you're going to be going through some high dose chemotherapy, you might experience some symptoms. The best thing that you can do for yourself is to make sure that you're well nourished prior to starting treatment. So, no unintentional weight loss, choosing some good calories and protein. Sometimes in these situations, even putting on a little bit of weight can be helpful too, just to prepare, knowing that some of these chemotherapy treatments can be very harsh on the body. If you know you're going for something like a stem cell transplant, my suggestion would be, do the calories, do the protein even before you start treatments, because then you're well nourished, you're going into it well nourished, well educated, good toolbox. But that would be just an example of one.
Okay. And we talk a lot about weight loss, and you did briefly mention weight gain as well right now, but there was a question about that as well. How do you manage nutrition when you're gaining weight?
So again, quite complex, depends on the individual, but if you're gaining weight, again, it's quite multifactorial, and sometimes I do see weight gain in this population due to steroid use, right? And that helps stimulate the appetite, and you're eating a little bit more. A good thing that you could consider if you are starting to notice some unintentional weight gain, it could be taking a look and seeing what you're choosing and what you're gravitating towards. Oftentimes, it's really hard to cut out something cold turkey. So, as long as you know that, okay, a healthy plate could be half fruit vegetables, quarter protein, quarter whole grains. Start subbing out specific foods slowly, is what my suggestion would be. But essentially, you'd want to limit added sugars. You would want to choose more lean proteins, right? So, chicken or fish would be some good options, or even some plant-based proteins like legumes and beans. Choosing less simple carbohydrates, still need the fruits, still need the dairy. Again, I'm not asking to fully eliminate, but choosing less and maybe subbing certain things out. And then maybe also eating less saturated fats if you find that you're gravitating towards more fattier meats or even fried food too.
Perfect. And with that said, thank you everyone for joining this session, and Jenny for that fantastic presentation and for taking the time to answer questions today. Small segue, but before you leave today, please be sure to visit the survey tab on the conference platform to provide your feedback, as it's greatly appreciated as we plan for our 10th anniversary conference next year. Additionally, Lymphoma Canada does offer many supportive resources available for patients, so please be sure to visit the resources tab as well, where you have the ability to email yourself the resource that you're interested in. With that said, I would now like to direct the audience to attend the final session of the day titled Exercise for Lymphoma Patients, Maximizing Energy and Reducing Fatigue. Thank you, everyone, and I hope to see you there.
Thank you.